Good morning, everyone. Like Amy said, I am from the Aboriginal Health Council of WA. So if I slip into AQUA, it is the Aboriginal Health Council, not the aquarium in Hillary. My family background is my mum's a Noongar person from Perth up into the wheat belt, and my father is Scottish, so I have a foot in both sides of the world. I was raised by my mother's family because my parents split up when I was young. I trained as an Aboriginal health worker, and I've worked at Derbyl, what used to be the Perth Aboriginal Medical Service, for 25 years, and I've been at AQUA now for 8. So a lot of my role has been service provision, working with people who want to work with Aboriginal people, and now I work in advocacy and training. And I can't take credit, I stole someone else's slides and just put my information on them. So when we talk about Aboriginal engagement or partnering, we've seen lately a huge influx of organisations who want to partner with Aboriginal organisations to get funding grants to run programs. So it can be quite challenging for some communities. We've had stories from remote communities where they get 19 services a week, where people come and want to run services and the community's not sure who they are, what they're doing. But for a small community that gets no service, if you go and ask them, do you want a service, they're not going to say no. And I'll go into it a bit more detail. So the first thing is about consultation, and a true form of consultation. Like I said, don't go and say, do you want a program that addresses fetal alcohol syndrome? It would be a very few communities that say, no, we don't actually want that. So they say yes, but it might not be their priority. So when you consult, asking what are the problems, what are your priorities, how can you work with us? Involvement throughout the whole process. Again, I think someone spoke, I think it may be you earlier this morning, about don't develop a program and then come and say there's money available for this, we're going to do this, do you want to be involved? So when you see grants, go out to the community and say, you know, look, there is some funding around this area, what can we do to work with you in partnership? Create an environment where it's equitable to everyone, so whilst you get to meet your program deliverables and reach your achievements, there are benefits for the Aboriginal community. Ethics here, I was just talking about ethics, but this was a research slide. But get Aboriginal community members as partners on planning, on evaluation, so you have that Aboriginal input throughout the program, not just to support it, so you get the funding and then they deliver the program out there. Or set up reference groups. So there are some programs that have reference groups that target different areas. I didn't change this one either. I've used fire, and I've related the next 3 slides to fire. For me and for most people in the Aboriginal community, when you talk about a fire, it's a place where we gather, it supplies warmth, it provides protection, but more importantly, it provides an opportunity for us all to sit together and learn from each other, share stories, share our journey. And, you know, as a child, you learn from your parents or your grandparents, so it is a place where information shared, the community gathers strength. So how do we ignite passion for partnerships? So we need fuel for the fire. So, oh no, maybe this is the wrong slides I've sent you, so don't just watch the fire and I'll just talk here. So the first thing you want to do is make sure the community knows your organisation. Like I said, lately we've been approached by organisations that have never ever been involved in the Aboriginal community. We've never heard about them until funding grants come out. Then all of a sudden they want to be partners. So go out into the community, so if people know your program, then they'll want to engage with you because they know that you're not just there because there's a funding application. Then you'll get support from the community. Let the community know what the benefits of the program is. So again, and if you involve Aboriginal people from the start of the program, you may get benefits that you may not think of, because you'll get that input from the community context. Again, promote community leadership. So I probably won't have in these slides, but find a champion in the community. It might be an elder, it may be, I'm sure we see in lots of health promotion, we see our sports players, our actors, so people that have got a standing in the community. But if you get someone who's an elder, they probably have a little bit more connection to the grassroots people. So again, just look at the heading and the fire, forget the middle bit. So when you're gathering kindling, or you need something to start the fire and keep it going, go out, and when you talk about consultation, I'm pretty sure in the metro area and even in the remote and regional areas, there's not just one family. So in the Noongar Nation, which is from Perth out just to the Wheat Belt down to just before Albany and back up, whilst that is all the Noongar Nation, within there's 11 to 14 different tribal groups. So if you're going to consult for that region, make sure you consult families in each of those particular tribal groups, not just 2 or 3 Aboriginal Noongar people and say that they represent the Noongar Nation. So make sure you find them. There are organisations where you can go to get that information. So ACWA is one, the Land and Sea Council. They usually have a list of elders that you can contact to give advice on different things. So if you contact them, so I think each region has a Land and Sea Council. You can look them up on the website. Consult organisations that have been around for a long time. We get a lot of grants come to us and say, we want to do this program, what do you suggest? We always suggest contact your local Aboriginal medical service, your local counselling service, drugs and alcohol services. There are local elders groups, mums and bubs groups. So we can, whilst we don't provide a service, we can connect people to where to go to get consultation. We know a lot of events where you can go and maybe have a stall and get community consultations. So make sure if you're going to do it, consult with a wide group of people. And I suppose that comes to planning. So if you've got an idea and you're waiting for funding to open, start your consultation with the Aboriginal groups early, so you're not going to rush it. The other thing you want to do is engage the right organisations. So again, some people will say, well, they'll go to a regional area and say, look, we've got a private GP and they've left out the AMS. If you want Aboriginal people, particularly in remote areas and in the metro area, your programs to be promoted to Aboriginal groups, go to the AMS. It's a meeting place. You'll get Aboriginal people. The health workers that work there are trusted. We have a thing in the metro area, we call it the Noongar Grapevine. Has anyone heard of that? No. So I've worked in the AMS, and if people come in and they're treated badly or they've had a bad experience in, I'll say, the hospital, they tell their families who tell their family members and their friends, and then people won't go to that hospital. Or if people haven't been there, they'll go to the health worker and say, I'm going to Royal Perth, what do you think? And if the health worker says, look, I have a good experience, they ring us often and ask advice, and that family will trust that service. So the same thing, if they're not sure of, I don't know, what organisation are you from?
Me?
Yeah.
I'm a counsellor.
From?
Sharon Bushby.
All right, so if someone's referred to you as a counsellor from the town of Cottesloe, they might go to the AMS, they might have referred you, so they might come to me as a health worker and say, look, I've been referred to the town of Cottesloe Counselling, have you had any experience with them? And I say, yeah, I know, I can't read your, Rob, and he's got a good experience. You know, he's often talking to us about how we can improve his service with Aboriginal people, and that puts that person's fear at ease, and they'll go and see that person. So use your Aboriginal services, your Aboriginal health workers as that connection to the community. So once you've got your fire lit and you've got it going, you have to keep Aboriginal people engaged. So providing regular feedback and saying this is where the stage is at. This is what we've done so far. These are some of the challenges. So either have a newsletter, have a little, I don't know, a thing on your wall where your service, whether they use. If you've got an advisory group, if you have regular meetings, they will feed back to the community what's happening. If there are challenges, and I'm sure there are challenges, I'm yet to meet a program that hasn't got challenges, include your advisory group or the Aboriginal community in those solutions. For instance, someone talked to us about a program came in, interesting, and it ties into injury control, that this program was running a program on seatbelt and wearing seatbelts because of traffic injuries. And so, but one of the things that came out in that particular community is a lot of people were driving without licences, and that was because in their community they had to drive to the bigger regional town to get a licence, and a lot of them didn't have people with licences to drive them there, so they were driving themselves to that appointment, and they were often getting picked up on the road without a licence. So they talked to the community about how they could address this, and the community said, well, why don't you approach, was actually a local AMS. They run a program about getting young people driver's licence, so they might be able to help us. So in a partnership they came up with a program. I don't know if it worked, but at least the community could tell that program how to address that barrier. So again, someone else said, I can't remember, celebrate the successes. For Aboriginal people, and I'm sure if I asked people here what you knew about Aboriginal people, there would be some very sad stats. We don't often celebrate what's working really well. So when we have successes, promote our successes. So in Fitzroy Crossing, a program up there that runs the program, they went up with a paediatrician on FASD. It wasn't really working. He spoke to the grandmothers. They got behind it and they've driven that program, and they've had some really big successes around FASD because it's owned by these grandmothers. They're the elders in the community and they are really pushing this program. So it works, and he's published the successes, not the challenges, like not the negatives, like how many Aboriginal people drink, how many numbers of FASD. We all know that. Probably lots of us could almost quote, I could quote that in sleep, but what we don't hear about is the successful programs. Benefits for you and for the community is you'll get different perspectives. So, you know, for Aboriginal people, we had a talk on falls prevention, and the target group was 65. One of the biggest challenges to get our Aboriginal people into falls prevention is often we're starting at 45. So it's shame for them to go because they feel like they shouldn't be there, they're too young. So just hearing that perspective helps us think how we're going to target our program. You'll get the cultural context and the I suppose, the concepts behind that. You'll get an understanding of Aboriginal priority. One of the issues we have is Aboriginal people, for a very long time, have had programs come in that are funded and they do a lot of good work, and then the funding ceases and the program disappears, and then a year later another program comes almost the same and they say, we had this great idea, do you want to do it? But for Aboriginal people it's like, well, we started this, we bought into it, it finished, you left, now you've come back and we're starting again. So just understanding why maybe that's not a priority anymore. Things around grief and loss, suicide of young people are all priorities in the community, so it's hard to think about, you know, promoting healthy eating if you're dealing with the death of 3 or 4 in one community in a fortnight. Or they lost 9 people to suicide who are under 25. So if your program is going to that community to run healthy eating and exercise, you're probably not going to get a lot of buy-in from that community. Ownership, people own. I'm sure this is across the board, but for Aboriginal people, ownership, feeling like they belong to the program, helps them engage and stay engaged. I also think respect to cultural ways of working is an important if you've got Aboriginal participation. Things around genders, male and female family relationships, so mothers, who can't be in programs with son-in-laws and vice versa. It helps you think about that. Who family is a big... So when we talk about family, it's not just mum, dad, grandmother and the kids. It's every... Aboriginal people have a very extended family. So if you get buy-in from the senior in that family, you will get quite a big buy-in from the community. It's not on here, but one of the things to think about are the social determinants of health. So when we talk about health promotion and funding programs, it's very hard. We have a tobacco team in our organisation that just focuses on getting people to quit smoking. But we've taken a bit of liberty to say you can't just do that, because tobacco use often is a symptom of everything else that is happening. So we try and address, healthy eating, exercise, employment, that sense of belonging. So you can't, it's hard to get someone to, and if I said to someone, what's more important, you quitting smoking or you having somewhere to sleep tonight, we've got to balance out that holistic view and how that impacts on partnerships. We're going to skip that slide and stay on this one. So in conclusion, I think Aboriginal communities are willing to partner, but what they want to see is meaningful partnership. They want to see organisations, and there are many organisations that have great partnerships with Aboriginal people through the funding they have, and then funding becomes available. But because they know those organisations and the staff within it, they trust them, and they will give and accept programs in. Aboriginal people want to close the gap, and they want to live the same life. They have dreams and hopes and aspirations, but what they want to do is have meaningful relationships. I myself, like I said, as a health worker, had lots of people come and say, we're going for this grant. Do you think this is a good idea? Do you want to be on the project committee? They come, they get the grant, we have one meeting and we never see them again, but the program's still running. So it's got to be meaningful both to you and both to the community. So again, there are lots of Aboriginal organisations in the metro area, in the regional area. Contact the peak body. So there's us, there's the Land Council, there's the ALS, there's lots of us. Please contact us. We want to work with people. I don't know if anyone knows, but there are 22 AMSs across the state. There's about 60 Aboriginal people, 60,000 Aboriginal people in WA. The 22 AMSs aren't going to be able to address all those needs. So one of the things that we're invested in is partnering with organisations to help meet those needs. So you've got 22 potential partners out there that are willing to work with you. So please contact us. We have a list of them. We have contacts. Please contact us. And I'm sorry that my slides got crazy.
More a question or a check. I was recently in Kimberley working with some people and we had a wonderful Aboriginal lady from Horse Creek, and she shared with the group, there was business people in the room, she shared with the group that just because Aboriginal people don't look you in the eye doesn't mean they're not deaf. So if they're not looking you in the eye with, or whatever it is going on, because we're used to, if you don't look someone in the eye, they must be not trusting you or something. Is that common, or is that more to...
So it is quite common. It's interesting because, like I said, I work with doctors, and interesting. It is more predominant in the north and probably the desert, not so much in the metro. However, the metro area gets a lot of people down here for treatment that still practice that, and it's interesting when people come in to see the doctor, I've sat in, and the person won't look at it, so the doctor speaks really loud, and I think they're not actually deaf, they're just, but it's...
So if we understand ourselves first and then understand potentially the other culture, whatever it is, whether they're Vietnamese or Aboriginal or whatever, but to respect that, then we might get a lot further, a lot quicker.
You will, and you'll pick it up. You'll pick up with an Aboriginal person. If they come in and sit down, you will notice if they look at you, that they're comfortable doing that, but if they don't, you'll notice that they will look down, or they won't actually look at you. So it's, and I've seen people then turn to the computer and have the whole consult, the patient looking down and they're looking at the computer. And, you know, we say, find something you can talk about where you're both looking at a central point, so you're not actually looking at each other. Or again, use your health worker. And you'll notice it's also a sign of respect for elders. So you'll notice a lot of us young health workers, when an elder comes in, we don't actually look at them, we gauge how comfortable they are with it, but we will talk sort of, we'll look towards them, but not actually look them straight in the eye. It's actually a sign of respect. And often once you build that rapport with the particular doctors or whoever, you'll see that change a little bit. But it's not that they're not listening, it's just a sign of respect.
As a grant provider, so we provide some small grants, we've been speaking to people, and it's kind of coming, so we want Aboriginal community and organisations to apply for grants for Aboriginal people. What can we do, I guess, to make, I don't know, is there something we could do to make the application process more conducive, I guess, to those cultural ways of working? Like, I guess we're conscious maybe that our application process is limiting people applying that might have good ideas and that would really benefit their community.
I think you're right, it is actually the application process.
Yeah.
If you've got a community group that doesn't have, say, a grants writer, they find the application really daunting, especially if English is, you know, their third or fourth language. Writing an application in English can be challenging. And we've seen some really good examples where grant people have actually gone to the community and had sessions and talked to them and again, like you've done today, said please ring us or whatever, but actually having someone available to help them, you know, sit with them and actually write the application for them. The AMSs can try, but again, some of the AMSs are time poor, so if you as a grants provider had someone they could contact or an Aboriginal liaison officer that could work with them, might be a way forward.
Okay, so doing things maybe orally a bit more.
Yeah.
Fantastic, thank you, Sharon. I think you might be available. Oh, it's from a webinar?
Yeah.
All right, we might take this.
Yeah, I actually have a comment, not a question, and it's from Leslie House, who works in Community Aged Care in Busselton. She would just like to urge everyone at the seminar to look at your own organisation and how many Aboriginal people are using your services. If there are none or very small numbers, then look at ways to make your organisation more accessible. Sometimes it relates to literacy and the use of terminology, sometimes transport issues, lack of trust completing referral assessment forms with loads of questions, etc. Often the systems are not culturally appropriate.
We might take that as a comment. Thanks, Alton. Thanks, Sharon.